Diabetes affects 1 in 8 Americans and is the most expensive chronic disease in the U.S., but it is also deeply unequal. Black Americans with diabetes are more than twice as likely to end up on dialysis or experience other serious complications compared to their white counterparts. A new paper in Annals of Internal Medicine suggests that tailoring screening for diabetes by race and ethnicity may catch cases earlier, leading to better outcomes for minority populations.
What we found is that even among normal weight Americans, the rates of diabetes are 2 to 4 times higher in individuals from Black, Hispanic, and Asian American communities than individuals from white communities. So we think that for diabetes screening to be more equitable, it should be offered to normal weight adults from minority populations in the US.
The authors note that updating guidelines for screening in minority communities could lead to patient treatment sooner.
Individuals from racial ethnic minority groups are at increased risk of diabetes, and yet, because they don't get diagnosed and treated on time, have disproportionate complications such as kidney failure and heart attacks.
Despite the high prevalence of diabetes among minority individuals, these individuals may not be screened, resulting in delayed diagnosis of diabetes or prediabetes. This is a missed opportunity for early intervention.
The study asked the question, what would it take to make screening more equitable?
We find that screening Black and Hispanic Americans at a BMI threshold of 18.5 and Asian Americans at a BMI threshold of 20 would be equivalent to screening white Americans at a BMI threshold of 25, which is substantially different than the current guidelines for diabetes screening.
They also note that screening minority groups at an earlier age could be helpful.
Because individuals from racial ethnic minorities are at increased risk of diabetes starting at earlier ages, we think that among persons who are overweight and obese weight, we should start screening the early to mid-20s in minority populations compared with 35 in white populations.
For more information, go to annals.org.